RESPeRATE is the world's only medical device cleared by the FDA as a non-drug treatment of hypertension. This brief presentation will cover the highlights of 16 published clinical studies which have looked at RESPeRATE's effectiveness in treating hypertension. RESPeRATE's clinical evidence is ranked 2A Level B by the American Heart Association scientific statement, Beyond Medications and Diet, Alternative Approaches to Lowering Blood Pressure. Its statement said that the overall evidence from clinical trials and meta-analysis suggests that device-guided slow breathing can significantly lower blood pressure. RESPeRATE has been proven safe and effective for a wide range of patients in 16 peer-reviewed clinical studies. 5 of the studies were randomized controlled. All studies included the same 8-week daily treatment with RESPeRATE. The studies demonstrated repeatedly that RESPeRATE delivered significant, sustained reduction in blood pressure, whether measured at the clinic, at home, or with a 24-hour ambulatory blood pressure monitor. On average, blood pressure reduction was 14 over 8 millimeters of mercury, or points. RESPeRATE was found effective in both medicated and non-medicated patients. The clinical studies were performed in the U.S., Europe, Middle East, and Asia. No adverse reactions to RESPeRATE were reported. This graph shows the kinetics of RESPeRATE therapy using home blood pressure monitors. The study revealed a significantly larger sustained blood pressure reduction using RESPeRATE versus the control group, and this reduction was achieved within a few weeks. This graph shows the group average of 24-hour ambulatory blood pressure monitor measurements before and after an 8-week treatment with RESPeRATE. This study demonstrated RESPeRATE delivered a significant sustained blood pressure reduction during the awake phase when the blood pressure was high. It's important to note the graph shows RESPeRATE did not lower blood pressure at night when blood pressure was already optimal. The study indicated there was a greater response for older, more severe patients. This graph shows that patients older than 65 saw greater blood pressure reductions averaging 16 over 7 points. And these two graphs demonstrate the blood pressure baseline dependence. The left graph is systolic blood pressure, and the right graph, diastolic blood pressure. In this study, patients with severe initial blood pressure above 160 over 100 had an average drop of 25 over 12 points within 8 weeks. Interestingly, it also demonstrated that RESPeRATE has a normalizing effect. It didn't lower the blood pressure below optimal 80 points diastolic. This chart is taken from the randomized multicenter controlled U.S. study which won RESPeRATE FDA clearance for use without a prescription. The study demonstrated slow breathing was the active component of the treatment. It showed only 45 minutes a week of slow breathing using RESPeRATE delivered a significant 14-point blood pressure reduction above any other concurrent treatment. Patients who had not undertaken slow breathing experienced a mere 3.8-point reduction nearly identical to the control group. On the other hand, patients who used RESPeRATE more extensively experienced an average reduction of 16.8 points. These charts show the blood pressure and compliance results from a 6-month follow-up. The left graph demonstrates that the lower blood pressure values of patients using RESPeRATE were not only maintained, but actually continued to improve over time. The right graph shows that patients complied with the recommended 45 minutes of slow breathing per week regimen. Beyond the 16 clinical studies proving the safety and efficacy of RESPeRATE, 4 studies demonstrated the physiological mechanism of action behind RESPeRATE's results. This graph depicts a reduction of muscle sympathetic neural activity while using RESPeRATE, resulting among other things in a sustained decrease in peripheral resistance and arterial stiffness. Lastly, a survey performed in partnership with Ipsos Ventis revealed a high degree of satisfaction by RESPeRATE owners. 86% said RESPeRATE continued to improve their blood pressure. 85% used RESPeRATE regularly in the past 6 months. 88% were satisfied with RESPeRATE. 77% would recommend it to a friend, and 97% found RESPeRATE to be easy to operate. We hope you enjoyed this presentation covering the highlights of clinical studies featuring RESPeRATE. Feel free to download our printable clinical information brochure to take to your doctor. Our clinical team would also be happy to answer any question he or she might have.